Right, that story by Sada Hassan sets the stage for us for this conversation. Our Dr. Mercy Correa, Health and Science Editor, is still in studio here with us. Thank you for staying with us. Perennial strikes, and right now, worse off that it's amidst a pandemic. But the issues that we keep encountering every time healthcare workers of any kind go on strike always revolve around the same things. Why?
If we look at the genesis of all of these things, it's been after many years of healthcare workers being underpaid, working in poor working conditions for many years, even before devolution happened in 2013. So I remember the very first strike of the doctors was in 2011, immediately after the doctors' union was registered. Right. And that was the first healthcare workers' union that was registered, because after that, the nurses came in and the clinical officers and all these other cadres of the health sector were registered. And so the clamor was, to remunerate healthcare workers in a manner that is commensurate with the work that they are doing, right, and improve their working conditions so that they are able to work and offer services. Right. So 2011 was the first major strike by the doctors, though it lasted for about 5 days, and pay improved. I remember doctors were on a basic pay of 40,000, and now it has gone up by almost 3 to 5 times that, because of that clamor. Right. Then 2016, 2017 was one of the longest strikes, 100 days for doctors. Nurses were on strike for several months, the clinical officers, and the issues have always been the same. But we have seen some strides because the healthcare workers have been able to sign some collective bargaining agreements with their employers. They've been able to get some gains from all of this, but still we're not where they would want to be in terms of remuneration, in terms of the government, both national and county governments, keeping their promises of paying them what they need. And so that's why we see all of these things. And it is sad, Akisa, that we are having this crisis in the middle of a global pandemic. Yes.
But then, so you say that, this is something that has happened, and we've all seen it happen, sometimes longer, sometimes shorter. There have been so many strike notices in the past few years. Are we likely to continue seeing this? How do we crack it? Because initially it was expected that devolution would crack some of these things for us. And now there's a whole conversation on the BBI and whether Health Commission will help us. Where is the idea? Where is the right idea?
So there are many schools of thought around, solving this. And one of the proposals, which was actually sent to the BBI, was, to have some aspects of the health sector being managed under national government, because this is a scarce resource. Remember, you have only a few thousands of healthcare workers. There are areas, devolution was meant to solve some inequalities that have been there. Right. But you still find that there are some areas which do not have the kind of doctors and the kind of facilities they would want to have. So the thinking was that, and this was proposed in the BBI, that you have some of these facilities managed under national government, and some under county governments. But we've seen that, it is still conversations. The other big issue and the big elephant in the room, I would say, is one, political goodwill, because we've seen that there's a lot of politics around healthcare, and with political goodwill comes a lot of resources, of course, channeling resources towards the health sector.
And the big question right now is, what really is ailing the health sector? I'd like you to comment on this story we're about to run. The tussle between healthcare workers and county governments has been going on for a while now, with two levels of governments, each wanting the other to take responsibility when it comes to solving what ails the medics or the sector at large. The fourth schedule of the Constitution of Kenya 2010 outlines the shared functions of health and the responsibilities of the county governments. But this seems to be the bone of contention between the national government, the county governments and health workers, as KTN News Health and Science reporter Beldine Waliaula tells us.
The Council of Governors, in a letter dated 14th December, say they are unable to meet the demands of healthcare workers because they had not received their monthly allocations for October, November and December, urging the unions to approach the respective county governments on issues that are county-specific to discuss their grievances.
The chair of the Council of Governors had said that the issue of risk allowance was the issue that should be handled at the national government. Now we have a Ministry of Health saying, yes, we are committing to look for money to finance this return to work agreement in terms of risk allowance. And then we have a Council of Governors now shifting their goalposts.
According to the council, each county is an employer in its own right, at liberty to sign the return to work agreements with the medics.
I think the refusal to sign agreements, the refusal to implement agreements is basically brinkmanship, nothing else.
During the negotiation, the Secretariat of the Council of Governors were always present, and we believed that they came there with all the authorities and the mandate to represent the Council of Governors. Therefore, the Council of Governors cannot come around again and say we were not involved and we were not represented.
In another letter this year, the council raises concerns that the monetary implications of the return to work agreements had not been factored in the current budget. Further, items like risk allowances need the approval of the Salaries and Remuneration Commission.
So if the county government thinks that they have their own money, they want to run their own government, then they should generate adequate revenue to run their own government and their own budget. But as long as they are still depending on consolidated fund and money allocated to them from the national parliament, they will have to allow the issue of remuneration to be discussed at the national level.
Dr. Chibanzi Mwachonda, the acting Secretary General of the Doctors Union, says that doctors working under counties go through a lot of challenges that the Council of Governors has not addressed.
So promotion issues, tribalism and nepotism issues are real. These are issues that we put forth in a memorandum that we submitted. It's public knowledge, where a county would advertise, and if it's advertising for 30 positions, you find that 28 of those positions are basically natives.
The medics now want a uniform way of handling their issues in all counties.
There's still a problem in how issues on human resources for health are handled in the counties. So there's lack of uniformity. It's all dependent on the county administration and how they want to interpret.
With no end in sight for persistent disputes between the counties and the health workers, the stalemate only means one thing: that the cause of the health sector in Kenya is in urgent need of attention. Belden Walyaula, KTN News.
All right, back here with Dr. Masi. So then the push and pull between the national government and the county governments is the health workers that are suffering currently. It was clearly stipulated on, shared responsibility between these two levels of government. So what's amiss?
Well, the healthcare workers are suffering, and we, the Wananchi who are seeking healthcare services, suffer the most. So from the fourth schedule, the national government is supposed to do health planning and policy and the national referral facilities, which is really a small part of the health sector. Then the rest of the health sector, from the county referral facilities all the way to your primary healthcare facilities, are supposed to be run by the county government. But there have been very many schools of thought, and I think that many agree that one, possibly we devolved healthcare sector too fast, and so people did not have a time to lay out the process of how, what will be handled and in what manner it will be handled. That's one. The other thing, which is probably the biggest bone of contention, and sadly where politics plays a part, is that counties tend to prioritize more on the curative healthcare services. This is why you hear, we have these CT scans, we have these dialysis machines. These are things that are tangible, that, we've built this ultra-modern facility, these are tangible things. But then the other bits that really matter, because these speak to the outcome of the health services that you offer, like the preventive and promotive part of health, are neglected. So there's been a lot of focus and a lot of money being channeled into these curative health services at the cost of this that could, that could help the Mwananchi. So this could be where the bone of contention is. So what you see eventually is that there's hardly any money or any resources that go into these other things. Because if you think about it, if you were to employ and remunerate your healthcare workers, the Wananchi and the electorate who are to vote will not see that. It's only that person who's earning that salary who will see. So that's why, when it comes now to crunching the numbers, is where all of these things have to be thought about. Where do you put what?
Yes. Everyone who's had anything to say, from the Council of Governors to the healthcare workers themselves, CECs in the counties, it boils down to financing healthcare.
Definitely, definitely. And if you look at, so the Abuja Declaration, which Kenya is a signatory, said that any country that is a signatory to that should have 15% of its national budget
yes.
in the health sector. But if you look at our budget as it is, if you combine what the county governments are putting into health, what the national government is putting into health, you'll not go beyond 7%. That means you are really doing badly. And then with the money that is already there, where are you putting that money? Are you focusing on, buildings and machines, or are you focusing on putting in systems? Are you looking at the health outcomes? How many of your people are healthy?
Right.
How many people have you diagnosed early, for example, to prevent from, getting cancer? And let me give an example of cancer. When a cancer is got early at stage 1 and it's treated, it's much, much cheaper. And it means this person will survive and they'll be productive members of, of society. But when you focus on, we have a PET CT scan or a mammogram, and those things at the late stage, then it means you're only capturing these things when it's too late.
Right.
So it's about prioritizing where to put in money. And sadly, that's why we see now these things, the push and pull when the healthcare workers are here. And it's sad because these have been issues now. This is 10 years into,
we still
in
see
this
them
millennium,
happen.
we still see them happening.
Right.
So I think it will take a good political goodwill for the Council of Governors, the healthcare workers, the national government to really sit down and make sure that they solve these issues, because then we'll not be able to handle the pandemic that is currently plaguing us.
Thank you very much for joining us, helping us try to understand some of these issues. I'll be picking this conversation up a bit later with Peterson Wachira. He's a chairperson of the Kenya Union of Clinical Officers. I'll be speaking to him together with Dr. Andrew Mulwa, who's the national chairperson of the Nation CS's caucus, as well as the CC Health for Makueni County, just to get